Trout is often perceived as a healthy fish because it is natural, relatively lean, and rich in omega-3 fatty acids, but for people with gout or chronically elevated uric acid, it carries meaningful risks that are frequently underestimated. Trout appears on many high-purine seafood lists because its muscle tissue contains a relatively high concentration of purine nucleotides compared with white fish such as cod, haddock, or sole. When these purines are metabolized, they increase uric acid production, and in susceptible individuals this can push blood urate levels past the saturation point where crystals form. For someone who already has impaired uric acid excretion, insulin resistance, kidney stress, or a history of frequent gout attacks, eating trout can quietly raise uric acid for days after a meal, even if no immediate flare occurs. One of the dangers with trout is its health halo. Because it is commonly recommended for heart health, people may eat it in larger portions or more frequently than riskier foods like organ meats, assuming it is safe. Regular consumption, however, can contribute to a cumulative uric acid burden that makes gout control much harder over time. This is especially problematic when trout replaces lower purine proteins on multiple days per week or is eaten alongside other urate-raising factors, such as alcohol, dehydration, or high fructose foods. Smoked, cured, or heavily salted trout can be even more problematic, as salt promotes fluid shifts and dehydration, reducing the kidney's ability to excrete uric acid efficiently. While trout does provide valuable nutrients, including omega-3 fatty acids that support cardiovascular health, high-quality protein, selenium, and B vitamins, these benefits do not cancel out its gout risk. Omega-3s may help reduce systemic inflammation, but they do not prevent uric acid formation, and they do not reliably protect against crystal deposition in joints. In practice, many gout patients report that trout triggers symptoms just as reliably as other oily or semi-oily fish, particularly when portions exceed modest serving sizes. A typical restaurant portion can easily double what might be considered a safe amount for someone trying to manage uric acid. Another concern is that fish proteins, including those in trout, can increase uric acid even when overall calorie intake is controlled. This means that weight loss or clean eating does not automatically make trout safe for gout-prone individuals. People in the early stages of gout, who may not yet experience dramatic flares, are particularly vulnerable to overlooking this risk and unknowingly accelerating disease progression. Repeated low-grade uric acid elevation can promote silent crystal deposition in joints and tissues, increasing the likelihood of more severe attacks later. For those with gout, hyperuricemia, or reduced kidney function, trout should be eaten cautiously, in small portions, and not frequently. Rotating proteins is essential, and lower purine seafood options should dominate the diet rather than oily or moderate purine fish. Completely avoiding trout during active gout flares is strongly advised, as the added urate load can prolong pain and delay recovery. Even outside of flares, relying on trout as a staple protein increases the risk of unstable uric acid control over time. In summary, trout is nutritious, but not metabolically neutral for people sensitive to purines. Its relatively high purine content, combined with its tendency to be overconsumed due to its healthy reputation, makes it a risky choice for gout management. Treating trout as an occasional food rather than a regular dietary staple is a far safer strategy if long-term joint health, kidney function, and stable uric acid levels are priorities.